This is instructional video on how to use SAM Checklist Navigator. To bring up the SAM Checklist Navigator, press F6 in DOCSIS Merge Ames computer. The Checklist Navigator can be displayed on the big screen in the OR by clicking or touching Remote Display button. The steps for each corresponding checklist are displayed here in the main window. Different checklists can be accessed by selecting specific checklist from the drop-down menu. Current step and response are highlighted here with a brief description down below. In order to perform a checklist, for example SCOAP 1, we will select it from the drop-down menu and we'll go through each step. The nurse and anesthesia provider or surgeon confirm the patient identity by reading the wristband and comparing it to the chart. By clicking confirmed, it will allow us to move to the next step. The surgical site is visualized by the surgeon who attests that it is correctly marked. We'll click mark. The procedure is named by the surgeon. We'll move to the next step by clicking name. The nurse visualizes the consent and the procedure, and the consent is confirmed. We will click confirmed to move to the next step. The position of the patient during surgery is specified by the surgeon. Example, supine, prone, lateral. Any special or unusual positioning consideration should be discussed at this time. We'll click specify to move to the next step. The nurse responds whether the availability of blood is confirmed. We will click confirmed to move to the next step. Allergies are specified by anyone on the team who knows the allergies. If none know the allergies, consult the medical record and click the specified. Antibiotic prophylaxis is confirmed by the surgeon and anesthesia provider. Click confirmed. DVT prophylaxis is recited by anyone on the team who knows what has been done, and this is confirmed by the surgeon as being appropriate. Complete. Anesthesia provider will return to the checklist menu and open the pre-anesthesia checklist. Now we will click to go to checklist and select pre-induction anesthesia checklist. The suction is verified to be connected and working by the attending anesthesiologist and another anesthesia provider. We'll click working. The attending anesthesiologist and another anesthesia provider confirmed that the daily internal machine check was performed and is complete. We'll click complete. The attending anesthesiologist and another anesthesia provider confirmed that the anesthesia breathing circuit is present and has been manually checked for proper operation. We'll click check. The attending anesthesiologist and another anesthesia provider confirmed that the patient's airway was evaluated and an airway management plan is in place. We'll click evaluate. The attending anesthesiologist and another anesthesia provider confirmed that the required primary and backup airway devices are available. There's at least one LMA, at least 2 working laryngoscopes, and an intubating stylet. We'll click available. The attending anesthesiologist and another anesthesia provider recite and confirm any clinically relevant allergies. We'll click confirmed to move to the next step. The patient's MPO status and aspiration risk is confirmed by the attending anesthesiologist and another anesthesia provider. Confirmed. The attending anesthesiologist and another anesthesia provider confirmed that there is an appropriate EKG tracing on the monitor. Click on. The attending anesthesiologist and another anesthesia provider confirmed that a non-invasive blood pressure cuff is on the patient and the monitor is set to take a blood pressure at an appropriate interval. There is at least one blood pressure measurement on the monitor. We'll click on to move to the next step. The attending anesthesiologist and another anesthesia provider confirmed that there is an end-tidal CO2 tracing on the monitor. Click on. The attending anesthesiologist and not anesthesia provider confirmed that there is a pulse oximetry signal on the monitor. We'll click on. The attending anesthesiologist and not anesthesia provider confirmed that the monitor alarms are on and alarm limits are set. We'll click Set. The attending anesthesiologist and not anesthesia provider confirmed that at least epinephrine, ephedrine, atropine, and phenylephrine are available. We'll click Available. The attending anesthesiologist and not anesthesia provider confirmed that the IV access is in place and functional. We'll click Functional. Blood pressure and heart rate goals, if any, have been discussed and set by the attending anesthesiologist and another anesthesia provider. If no specific goals have been discussed, the blood pressure and heart rate goals may be set by default at routine levels. We'll click Set. Any special considerations not already discussed should be discussed now by the attending anesthesiologist and not anesthesia provider. We'll click Discuss. Now the checklist is complete. We'll move on to Scope 2, which we'll bring up from the drop-down menu. And we'll start with the first step here. Each team member introduces themselves and their role. If all team members are well known, the surgeon may elect to skip this item. We'll click Complete. Notification for personnel exchanges will be described by the surgeon. We'll click Describe to move on. The procedure will be described by the surgeon. Describe. The surgical site will be confirmed by the surgeon. We'll click Confirm. The expected blood loss will be specified by the surgeon. We'll click Specified. The nurse will attest that the equipment is ready. The surgeon should ask about the availability of any special equipment that is required. We'll click Ready. The surgeon attests that any required imaging is displayed. Click Displayed. The nurse attests that the surgical scrub is complete. Click Complete. Sharps management is reviewed by the surgeon. Click Reviewed. The fire risk is reviewed by the surgeon. The fire risk will generally be low or routine. If the fire risk is high or unusual, a discussion of precautions should take place. Click Reviewed. Antibiotic prophylaxis is confirmed by the surgeon and anesthesia provider. Since incision is imminent, a substantial dose of antibiotics should have been administered by this time. We'll click Confirm. The nurse attests that active warming is on if needed. We'll click On. Whether the insulin protocol will be needed or not is confirmed by the anesthesia provider. We'll click Confirm. Any unanswered concern of anyone on the team will be discussed now. We'll click Discuss. The surgeon will encourage comments and questions from the team. Click Done. If there's a specialty-specific checklist, the anesthesia provider will return to the checklist menu and open the specialty-specific checklist. We'll click Complete. Now that Scope 2 is complete, we'll move on to Scope 3. In the first step, prior to closure, the surgeon will sweep the wound and attest that this step is complete. We'll click Complete. Prior to closure, the nurse will attest the counts are correct. We'll click Correct. Now Scope 3 is complete. We'll move on to Scope 4. In the first step, the absence of retained objects will be confirmed by the nurse and the surgeon. We'll click Confirm. Specimen handling, labeling, disposition will be confirmed by the nurse and the surgeon. We'll click Confirmed. The procedure performed will be specified by the surgeon. We'll click Specified. The immediate post-surgical recovery plan will be reviewed by the team and designated as complete by the anesthesia provider. Pain management will be assigned to the acute pain service or the surgical team. We'll click Complete. The surgeon will lead a discussion with the team that includes mention of any needed process improvements or equipment issues. Complete. Now all the checklists are complete. If the item is not addressed, one can select Skip button here in order to move to the next step, as shown here. If the item is incorrectly marked, one can click or touch undo button in order to remove the response. The entire checklist can be reset by clicking or touching reset checklist button and confirming by touching or clicking yes button. And as you can see now, all the responses have been removed from each item. The SAM checklist navigator screen can be closed by clicking or touching close button. And the SAM checklist navigator screen can be relaunched by pressing F6, which returns to the checklist that was active when it was closed.